I guess kind of like we were talking about, everyone kind of lumps these like overfilled, weird looking people into this field. So it's kind of getting them over that fear. There's the fear of pain. I mean, it is a needle, so it does hurt a little as it goes through the skin, but it's not terrible. I think it's like fear of like a complication too. Botox, the biggest complication is you can get Botox in a muscle right up in your eyelid, and then you have like ptosis or like a drooping of your eye like this, and that it lasts like 3 months. It sucks. It's not pleasant. There are eye drops that help, but filler is scarier. Filler, you could get what's called an intravascular occlusion. So that means filler is a thick, viscous substance like a gel. And if you inject it into an artery, you could block that artery. And then whatever that artery is feeding blood to is no longer getting blood. So you can necrose, you could like kill someone's, skin, which is never pleasant. And there's ways out of that too. So filler, hyaluronic acid, there's an enzyme called hyaluronidase. So you inject that, hopefully under ultrasound guidance, but even just blindly, and you could reverse that. These just could be a little scary because if you don't do the right settings, you could burn people. Also, if they're on certain medications, certain antibiotics, Accutane, definitely we don't touch Accutane patients with lasers. Peels could get out of hand. Like you could have so there's legit. It is a medical practice. There are things that go wrong, and having done this 14 years, I mean, I've seen all of that. That's almost what you want. You want the guy or the provider to see that's kind of had some crazy stuff happen and has gotten out of it and has learned, like we said, like a failure that you learned. Like I had a bad occlusion. That's where I was injecting someone's nose. I got into an artery. The nose started dying. I was traveling at the time, which is crazy. And, I was just like doing a guest thing somewhere, like not in SD Botox in another clinic. And I mean, as a result of that, I learned ultrasound. I learned how it applies to this. I bought an ultrasound. I bettered my practice. I came out stronger as a result of it. The downside is of obviously that patient, went through some misery and so did I. But I mean, she's fine now and mostly forgiven me. So, and the practice is better as a result. So I mean, if you want to make an omelet, you gotta crack some eggs. Not calling her an egg or anything. I'm just saying if you want to do anything great in life in general, it's like like rewarding things are tough. And so you have to self-forgive and you have to make it right in some way when something does happen, and you have to fix it, and you have to learn and you have to then try to prevent it from happening again. Like I was like, I'm also interested in kind of medicine overall. Like one nice analogy I like is that when a plane crashes, the FAA like gets that black box and they study it and they find like, how do we prevent this from ever happening again? There's systematic changes that, or like something happens that, new procedure, whatever, that they prevent future plane crashes. Whereas in medicine, it's almost like the plane is crashing and our goal is to prolong the crash. Like instead of like falling to your death in 8 minutes, you're going to fall to your death in 12 minutes. It's like we're just like, you have diabetes and now we're going to put you on all these medications. It's like your quality of life won't be like, why didn't we put that same patient on medication before they cross some invisible line that we decided is the definition of diabetes? Why didn't we? So that's really the big shift in medicine now that I think is happening largely with the younger people is they're more preventative and they're really prioritizing their health and going to places like Hormones and Wellness by SC Botox and like, although, and it's the simple stuff too.